Hi, this is Philip Ador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about ectopic pregnancy. In ectopic pregnancy, ectopic means out of place. So when ectopic pregnancy means that a pregnancy happens somewhere other than in the uterine cavity. In order for the ectopic pregnancy to take place, a couple of things need to happen differently from the normal process of pregnancy. First, following ovulation, the egg must be fertilized and come to the rest somewhere other than the endometrium of the uterine cavity. Next, when it arrives at this destination, it must implant on a surface with rich enough blood supply to support for a developing embryo. Ectopic pregnancies have been known to happen on a various surface, including the ovaries, intestines, and most commonly in the ampulla of the fallopian tube. After implantation, the embryo starts developing and growing just like it would do on a normal pregnancy. Over time, a few different things can happen. Sometimes the tissues can no longer provide a sufficient blood supply for the embryo, leading to its death. On the other hand, if that issue can apply the embryo with sufficient blood, then hormones from the corpus luteum and placenta can lead to a missed menstrual period. Another body changes like nausea and fullness of breast, which are typically seen in early pregnancy. If the ectopic pregnancy happens in the ampulla of the fallopian tubes, it eventually runs out of space. Slowly, the ectopic pregnancy stretches the nerve fibers within the wall of the fallopian tubes, causing lower abdominal pain. Eventually, the expansion causes damage to the wall of the ampulla, potentially rupturing the fallopian tube. A ruptured ectopic pregnancy can lead to a massive hemorrhaging into the abdominal cavity, and the blood can irritate the peritoneum, which can cause referred pain to the shoulder. Occasionally, there might be a light vaginal bleeding, as well as a combination of internal bleeding, severe pain, and damage to the fallopian tube, make an ectopic pregnancy a medical emergency. The causes of an ectopic pregnancy in an individual is often unknown, but there are well-known risk factors. This includes smoking, a history of pelvic inflammatory disease, conceptions by in vitro, fertilizations, gynecological surgery, current use of intrauterine devices, tubal ligations, or previous ectopic pregnancies. Symptoms of an ectopic pregnancy include amenorrhea or missed menstrual period, pelvic pain, and vaginal bleeding. Typically, for an ectopic pregnancy in the fallopian tube, pressure increases as the tube stretches around to 6 to 8 weeks into the pregnancy. But if the ectopic pregnancy happens in a place with a lot of space for the embryo to grow, pain and bleeding might not happen until several weeks later. A physical exam might show a palpable mass near the uterus, abdominal tenderness, but these symptoms mimic a normal pregnancy and that can contribute to a delay in diagnosis. Diagnosis of an ectopic pregnancy can vary based on woman's health. It's important to establish that the hemodynamically stable, meaning her vital signs are within the normal limits, with no evidence of hypotension or tachycardia. If the woman is hemodynamically unstable, then immediately surgery might be needed to diagnose and treat the ectopic pregnancy. If the woman is hemodynamically stable, and serial HCG can be done to ensure that the levels are doubling approximately over every 2 days, which is typically in an early pregnancy. In addition, transvaginal ultrasound can be used to image the inside of the uterus to see whether or not there is an intrauterine pregnancy, which is typically visible by week 5 or 6 of the pregnancy. The transvaginal ultrasound can also help identify an ectopic pregnancy based on the signs and excess fluid in the peritoneal cavity. In a hemodynamically stable woman whose ectopic pregnancy is diagnosed early and Hg is already declining, treatment might include close monitoring of the woman's health with serial Hg measurements with no additional medications or procedures. If the ectopic pregnancy is identified later, then methotrexate can be used to terminate the pregnancy. In a hemodynamically unstable patient, a salpingectomy might be done That's where the fallopian tube is opened up to remove the pregnancy and then closed at the end of the surgery. Alternatively, a salpingectomy can be done, which is where the fallopian tube is completely removed. Alright, as a quick recap, in ectopic pregnancy, it happens when a fertilized egg implants somewhere other than the endometrium of the uterine cavity. Risk factors include smoking, pelvic inflammatory disease, in vitro fertilization, pelvic surgery, intrauterine devices, tubal ligation, and previous episodes of ectopic pregnancy. Treatment depends on whether the woman is hemodynamically stable or not. It might include close monitoring, methotrexate, or surgery.